Important message: cancer doesn't usually come out of nowhere. Your body whispers before it screams. These 15 signs can be early red flags. Ignoring them might cost you your life, especially in the United States, where cancer is the second leading cause of death. This knowledge can save lives. Unexplained weight loss is one of the earliest and most common signs of cancer, especially cancers of the pancreas, stomach, esophagus, or lungs. If you are eating the same, exercising the same, but still dropping pounds without trying, your body is signaling that something serious is wrong. Weight loss of over 10 pounds without explanation, especially in people from the United States, or Canada where obesity is common, often goes ignored because people are happy about losing weight. But cancer cells consume energy fast and also change how your body uses nutrients. In the United Kingdom and Australia, similar patterns show up, but access to early diagnosis can still lag behind. Doctors often dismiss weight loss as stress or diet change, but how many stories have we heard of someone who just shrunk rapidly and was diagnosed too late? It's terrifying, but it's real. Constant fatigue is another alarming red flag. This isn't regular tiredness after work or parenting. This is a deep, bone-level exhaustion that sleep doesn't fix. In the United States, many people push through it thinking it's just part of the grind. But when your body is fighting off cancer, especially leukemia or colon cancer, that constant drain is your body telling you it's under siege. Fatigue can precede diagnosis by months or even years. In Australia and Canada, people who have later-stage cancers often report extreme tiredness well before diagnosis, but they didn't think it was serious enough to check. It feels invisible, but it's dangerous. Pain that won't go away should never be ignored. Chronic pain in one area of your body could mean a tumor is pressing on nerves or organs. In the United Kingdom, persistent headaches have been linked to brain tumors, but often people treat it with over-the-counter meds until it's too late. In the United States, back pain is extremely common, especially with sedentary jobs. But if pain is severe, localized, or increasing, especially if it disrupts your sleep, it might not be muscular. Ongoing pain, especially when paired with no clear injury or inflammation, should raise an alarm. Changes in your skin, darkened patches, yellowing, redness, itchiness, or sudden hair growth can signal internal cancers. Skin cancer, especially melanoma, is aggressive and deadly. In the United States and Australia, where tanning is still popular, melanoma rates are among the highest in the world. If you notice moles changing in size, shape, color, or symmetry, that's a major danger sign. But internal cancers like liver or kidney cancer can also show up as strange skin changes. If your skin starts to look or feel different, and it doesn't go back to normal, cancer could be the reason. Persistent fever is a silent warning many overlook. If you have a fever that keeps coming back or lingers without infection, your immune system might be fighting cancer. This is especially true for blood cancers like leukemia or lymphoma. People in the United States often take Tylenol or ibuprofen and go about their day. But recurring fevers without a cold, flu, or infection might mean malignant cells are attacking from the inside. Night sweats and chills also tie in here. In the United Kingdom, night sweats are one of the most ignored symptoms, especially among men, but it's a top sign of lymphoma. Coughing that doesn't go away, especially a dry or bloody cough, could point to lung cancer. In the United States, this is often dismissed as allergies or smoker's cough, but when a cough lasts longer than 3 weeks, that's a problem. Even non-smokers can get lung cancer. Radon exposure, secondhand smoke, and air pollution in urban cities like New York or Los Angeles are silent killers. If your voice becomes hoarse or your breathing feels restricted, don't wait. Canadians in colder regions often blame it on cold weather or bronchitis, but persistent respiratory symptoms deserve a CT scan, not cough syrup. Lumps or thickening in the breast, testicles, lymph nodes, or other soft tissue can indicate cancer growth. Breast cancer isn't just for women. Men can get it too, and it's usually more aggressive because it's caught later. In the United States, mammograms are heavily promoted, yet some people still delay them due to cost or fear. In the United Kingdom and Australia, where public health care covers screenings, the survival rate is better because cancers are caught early. But once a lump changes in size, shape, or becomes painful, it's often already advanced. And swollen lymph nodes behind the ears, under the jaw, or in the armpits are major red flags. Your body is signaling an immune war. Unexplained bleeding is one of the most terrifying signs and almost always indicates something is seriously wrong. Blood in your urine could mean bladder or kidney cancer. Blood in stool might mean colon or rectal cancer, which is now appearing in younger adults in the United States and Canada more than ever before. Vaginal bleeding after menopause is never normal. It could be uterine cancer. Coughing up blood should lead straight to a scan. In Australia, where colorectal cancer rates are high, screening programs save lives, but younger people skip them thinking they're too young. That's a deadly mistake. Changes in bowel or bladder habits are easy to overlook but critically important. Diarrhea, constipation, or a change in the size of your stool can all be signs of colon cancer. Feeling like you still have to go even after going? That's a signal. If your urine flow changes, becomes painful, or is interrupted, prostate or bladder cancer could be behind it. In the United States, men often avoid talking about urinary symptoms due to embarrassment, but prostate cancer is one of the top killers. In the United Kingdom, bowel cancer is now diagnosed in people as young as 30. Waiting until symptoms are severe is a gamble you do not want to take. Difficulty swallowing, especially when it feels like food is stuck, can indicate esophageal or throat cancer. People often think it's just reflux or allergies, especially in the United States, where acid reflux is extremely common. But if swallowing becomes painful or you start to choke on your food or pills, you must get evaluated. In Canada and Australia, patients with upper digestive tract cancers often report this symptom months before diagnosis. The earlier it's caught, the better the chance of survival. Esophageal cancer has a poor prognosis if caught late, but an endoscopy can save your life. Indigestion or heartburn that doesn't improve with lifestyle changes or medications might be more than a digestive issue. Stomach cancer can present this way. Many people in the United States take daily antacids without ever thinking something deeper could be wrong. A burning sensation in the upper stomach that persists, especially if paired with bloating, early satiety, or unexplained nausea, needs to be taken seriously. In the United Kingdom and Australia, gastroesophageal cancers are often misdiagnosed as GERD or anxiety, especially in younger adults, leading to critical delays in treatment. Changes in the appearance of your mouth, such as white patches, sores, that don't heal, or bleeding gums, could signal oral cancer. This is especially dangerous for smokers or people who chew tobacco. In the United States, smokeless tobacco use is still common in some regions, and oral cancer rates reflect that. Dentists are often the first to catch it, but most people skip dental checkups. If you have a sore that lasts longer than 2 weeks, pain when chewing, or chronic bad breath, it could be more than hygiene, it could be cancer. Sudden changes. In vision or hearing are often linked to neurological cancers. Brain tumors can press on optic or auditory nerves, causing loss of sight or hearing. In the United States, people often think it's stress or eye strain from screen time, but if you lose peripheral vision, experience double vision, or start hearing ringing or muffled sounds without an infection, that could be cancer. In Australia and Canada, rare cancers affecting the cranial nerves have been found after patients reported subtle but persistent sensory changes. Early detection is the difference between treatment and tragedy. New or worsening headaches, especially those that wake you up at night or feel different from your usual migraines, can indicate a brain tumor. In the United Kingdom, delayed diagnosis of brain cancer is unfortunately common because symptoms are subtle at first. A headache that feels like pressure, comes with nausea, or is paired with vision problems or weakness must be taken seriously. In the United States, people often self-medicate with painkillers and continue working through it. But pain that doesn't respond to medication and disrupts your daily life deserves immediate imaging. We're only halfway through. In part 2, we're going to reveal more disturbing signs that people keep ignoring. Signs that cost lives every single day. These symptoms are happening more in younger people across the United States, Canada, Australia, and the United Kingdom. The clock starts ticking the moment these signs appear. Cancer won't wait. You shouldn't either. Persistent bloating is not just a women's health issue, and it's not always caused by food. If you find yourself constantly feeling bloated, full, or swollen in the abdominal area without eating large meals, This could be a symptom of ovarian, colon, stomach, or pancreatic cancer. In the United States, many women report these symptoms for months before a diagnosis, and in many cases, they are told it's just hormonal or irritable bowel syndrome. But when bloating doesn't go away and is paired with pain, weight changes, or urinary issues, cancer becomes a very real possibility. In the United Kingdom and Australia, many ovarian cancer diagnoses come too late because bloating was misdiagnosed. A bloated belly that's firm or painful needs immediate investigation, not another round of probiotics. Loss of appetite without reason, especially when it's sudden, could be a direct warning sign. Cancer impacts the way your body processes hunger signals. It's not just that you don't want to eat, your body actively resists it. In Canada and the United States, where high-calorie diets are the norm, a drop in appetite is often shrugged off as stress or emotional upset. But when cancer spreads, especially in digestive or reproductive systems, one of the first things to disappear is appetite. If meals begin to feel like a chore and food starts to lose its flavor, even your favorite meals, that is a red flag. Pair that with nausea or early satiety, and you could be looking at stomach, liver, or pancreatic cancer. Recurrent infections or frequent illnesses can be a sign that your immune system is compromised, something that happens with leukemia, lymphoma, and other blood cancers. When you keep getting sick, and every cold turns into something worse or lasts longer than normal, that's a problem. In the United States, parents are often told their child just has a weak immune system, but recurring fevers, sinus infections, bronchitis, or urinary tract infections should raise alarm bells. The same pattern exists in the United Kingdom and Australia, where even doctors admit blood cancers can fly under the radar for months under the cover of chronic flu-like symptoms. A healthy adult should not be sick every few weeks. Itchy skin, especially without a rash or obvious irritation, can be an early sign of blood-related cancers like lymphoma. Itching caused by internal disease feels deep, relentless, and does not improve with lotions or antihistamines. In the United States, dermatologists have noted how patients present with persistent itch, only to later discover a serious diagnosis. In Canada and the UK, similar cases occur where lymphoma is discovered only after months of failed treatments for supposed eczema or allergies. Your skin is an organ, and when your body is fighting internal cancer, the immune responses can manifest as chronic, unexplained itching. Sudden changes in your menstrual cycle, especially heavy bleeding, longer periods, or bleeding between periods, could be signs of uterine or cervical cancer. Too many women, especially in the United States, delay seeking help because they think it's due to stress or hormone imbalance. But abnormal cycles, especially post-menopause, are not normal. In Australia, national guidelines recommend immediate investigation of any irregular bleeding in women over 40, but not everyone follows through. Cervical cancer can cause bleeding after intercourse, which many women are too embarrassed to discuss with their provider. But silence leads to late detection. Persistent heart palpitations or unexplained chest discomfort can be an early symptom of cancers like lung or leukemia. Not every cancer sign is a lump or lesion. Some affect how your body functions. In the United States, chest pain is immediately associated with heart problems, but when tests show no cardiac issue, cancer should be on the differential. Certain tumors release chemicals that affect the nervous system or trigger immune responses that impact your heart rhythm. In Canada and Australia, internal cancers like mediastinal lymphoma have presented with pressure in the chest or erratic heartbeat months before diagnosis. When your heart starts acting strange, don't just blame it on anxiety. Ask for imaging. Changes in your nails, such as dark lines, thickening, spoon-shaped nails, or nails that suddenly become brittle or cracked, can indicate cancers like skin cancer or lung cancer. In the United States, melanomas under the fingernail are extremely aggressive and often found too late. People notice a dark streak but assume it's a bruise or injury. But nail changes can also reflect nutritional deficiencies caused by cancer or its impact on circulation. In the United Kingdom and Australia, doctors are trained to look at the nails during exams for this reason. Your fingernails are a window into your health, and changes should never be brushed off as cosmetic. A swollen face or neck, especially, when combined with difficulty breathing or a feeling of fullness, can be caused by a tumor pressing on blood vessels, particularly in cancers of the lungs or thymus. This is called superior vena cava syndrome and is more common than people realize. In the United States, emergency departments have seen patients with swollen neck veins and facial puffiness only to discover an aggressive tumor growing silently in the chest. In Canada, smokers are especially at risk, even if they've quit years ago. When your body swells in the upper areas without cause, it's not something to wait out. Unexplained bruising, especially on the legs or arms or gums, bleeding for no reason, may signal leukemia. When your body's platelet count drops due to cancer in the bone marrow, your blood loses its ability to clot properly. In the United States, adults often notice strange bruises and think they just bumped into something. But when bruises show up overnight, in unusual places, or take weeks to heal, that's a strong warning. In Australia and the United Kingdom, stories of people ignoring small signs like nosebleeds or spontaneous bruises have ended in tragedy when the real cause was blood cancer. Loss of coordination or new difficulty walking, speaking, or writing may be linked to cancers in the brain or spinal cord. These symptoms often show up subtly. Maybe you keep tripping over your own feet or your handwriting changes. Maybe you start forgetting how to do things you've done your whole life. In the United States, these signs are frequently dismissed as stress, fatigue, or aging. But cancer that affects the nervous system can quietly steal your motor functions. In Canada, multiple sclerosis is often misdiagnosed in patients who later learn they have brain tumors. You know your body better than anyone. If something feels off, it probably is. Puffy or swollen lymph nodes that last longer than 2 weeks are often the body's first immune response to cancer. Lymph nodes under your jaw, behind your ears, above your collarbone, or in your groin should not remain swollen. In the United States, people often think they have a lingering infection or cold. But when lymph nodes stay hard or continue to grow, that could be a signal of lymphoma, leukemia, or metastasis from another cancer. In Australia and the UK, public health campaigns stress the importance of checking for neck lumps, but they're often missed because people don't know what's normal. Shortness of breath or wheezing that doesn't go away, especially when it appears without exertion, could be a symptom of lung cancer or other cancers that have spread to the lungs. Many Americans with undiagnosed cancer are treated for asthma or COPD, when in fact their breathing problems are from tumor pressure or fluid buildup. If you're struggling to climb stairs, walk short distances, or even talk without gasping, and you were never this way before, it's not normal aging. It might be a growing tumor silently crushing your lungs. In Canada and Australia, this symptom is tragically common in late-stage diagnosis because it's ignored in non-smokers. Feeling full after only a few bites is a major sign of stomach or ovarian cancer. Early satiety happens when a tumor presses against the stomach or messes with digestive hormones. In the United States, where portion sizes are large and snacking is common, it's easy to miss this red flag. You might think you're just not hungry or trying to eat clean, but if fullness comes too fast and happens often, something deeper is wrong. In the United Kingdom, patients with advanced stomach cancer almost always report this symptom when looking back. Your body is always talking. Cancer rarely hides forever, but it whispers before it screams. These 15-plus signs could be that whisper. Across the United States, Canada, the United Kingdom, and Australia, people are dying from cancers that could have been treated if caught sooner. If even one of these symptoms sounds familiar, take it seriously. Waiting is the most dangerous decision you can make.